This is your video lecture for the procedures at the end of chapter 37 in your Modern Dental Assisting book. We're going to look at applying a topical anesthetic. So we're going to consider the following with this procedure. You should have your PPE on and have your tray set up with your barriers. We're going to include on our tray a 2x2 gauze square, our topical anesthetic ointment, and then a sterile cotton tip applicator. We would place a small amount of topical ointment on the cotton tip applicator and then replace the cover to the ointment. We're never going to insert the same applicator into the ointment after it's been used and contaminated. We would then explain the procedure to the patient. Patients are more comfortable and less anxious when they're well informed and know what to expect. We're going to identify the injection site, gently dry the site with the gauze. This is going to allow the ointment to penetrate the surface area better and not become diluted by saliva. And then we're going to place the ointment directly onto the injection site. We'll repeat previous steps if multiple injections are to be given. We're going to allow the applicator to remain on the site for 1 to 2 minutes and then remove the applicator just before the dentist gives the injection. Next procedure we'll talk about is assembling the local anesthetic syringe. So in a previous lecture, we talked about the parts of the syringe. Remember that we're always going to have our PPE on and we are going to have our barriers in place. For our equipment and supplies, we're going to have our sterile syringe, the sealed disposable needle or needles, and then our sterile local anesthetic cartridge. When selecting the anesthetic, our location of the injection will determine the needle length. The dentist is going to determine the type of anesthetic solution to be used. These choices depend on the patient's medical dental history and then also the procedure. We'll organize the supplies and position the items at chair side out of the patient's view, and we're going to wash our hands before preparing the syringe. To load the syringe, we're going to hold the syringe in one hand, use the thumb ring to pull back the plunger. With the opposite hand, we'll load the anesthetic cartridge into the syringe. The stopper is going to go in first towards the plunger. We'll release the thumb ring and allow the harpoon to engage into the stopper. Then we're going to use gentle finger pressure to engage the piston forward until the harpoon is engaged into that stopper. To check that the harpoon is securely in place, we're going to gently pull back on the plunger. We're going to break the seal of the needle and remove the protective cap. The protective guard or clear plastic is removed at this time. The needle guard is not yet removed. We're going to screw the needle into position on the syringe and take care to position the needle so that it's straight and firmly attached. If the needle is not positioned correctly, the anesthetic solution might leak or it won't flow properly. We'll place the prepared syringe on the tray so it's ready for use and out of the patient's sight. The last procedure we're going to cover is assisting in the administration of local anesthetic. Remember that we will have our PPE on and we're going to have our barriers in place. We'll have the topical anesthetic, our sterile cotton tip applicator, sterile gauze sponges, and our assembled local anesthetic syringe. We're going to apply topical anesthetic to the appropriate area. We'll loosen the needle guard. We're going to transfer the syringe to the operator by placing the thumb ring over the dentist's thumb. Remember that this exchange should take place below the patient's chin and out of the patient's vision. While the dentist is giving the injection, we're going to monitor the patient for any adverse effects. The dentist is going to replace the needle guard on the syringe by using a one-handed scoop technique or a recapping device. After the injection is completed, we're going to have the patient turn towards us. Rinse the patient's mouth using the air water syringe and the HPE or the saliva ejector. We'll continue to monitor the patient throughout the procedure for any adverse effects. At the completion of the procedure, we're going to instruct the patient about numbness and tell the patient not to bite their lip or cheek. Before leaving the dentist treatment area, we'll remove the needle with the needle guard still in place and dispose of it in the sharps container. We'll remove the anesthetic cartridge and dispose of it in the medical waste. Place the syringe on the tray to be returned to the sterilization center, and then we would document our procedure.